Hi, everybody. Thank you for joining. So this is Rachel. I'm very excited about this class for today. I know that we have some more people that's going to be showing up pretty soon, but in the meantime, whoever's here, you can just say how many weeks you are, maybe where you're from. That way we can kind of get to know each other. So you can, in the chat box, that's how basically we're going to be talking to each other. So what I love about this class is it's a very interactive class. I'm able to talk to you guys, answer your questions. I know that a lot of you guys probably have been taking the videos that are online, which is great, but at least this way we can talk one-on-one and get to know each other. So I guess we can start off. You can maybe say your name if you like, how many weeks you are, and where you're from. So I'm just going to write first. So I'm Rachel, I'm from Florida. So for those of you who don't know, I am a nurse. I actually work in the hospital full time. I work postpartum. And then I'm also a mom of two. I have a 2-year-old and a 4-year-old. So 22 weeks from Loxahatchee. So great, we have another Floridian, fantastic. So I'm very excited. Loxahatchee is not too far from me. I live in Boynton. So it's a small world after all. And then 22 weeks, at least you have a good amount of time that you'll be able to study and focus and learn lots of new things. So this is the second part of our class. So some of you probably have been in the first part where we talked about pregnancy and childbirth. In this half, we're going to be talking about postpartum care and newborn care. So this is mostly what to expect after you deliver, kind of for you, for the baby, how to take care of yourself and your baby. If you missed the first half of the class, on my YouTube channel, you'll be able to see Childbirth Masterclass. Part 1, it says pregnancy and childbirth, and you can catch up on those. And you can also sign up for the next ones as well on the comment section of this video. You'll be able to see the link that you can use to sign up. So it's very great, and I'm very excited to have all of you guys with me. So to start off, we're going to talk about postpartum care. And I know that when you guys are looking for things, most of the time, they research on about childbirth and pain management techniques and breastfeeding, which is great. But you need to learn how to take care of yourself as well. Moms, they are notorious, just like nurses. We take amazing care of other people, but we don't really focus on ourselves, and we really should be able to take care of ourselves. So a few things just to know about what to expect after you deliver. By the way, for those of you who just joined, if you see the comment section, you'll be able to see how many weeks you are. You could just write how many weeks you are and then where you're from, just so we can kind of get to know each other. And then especially the weeks, because then I can figure out what we can talk about and what would be more specific to you as a family. And also, the more interactive you are, the better chances you will have of winning our giveaway. In the end of this lesson, I will actually be doing a giveaway. And the giveaway will be for $25 credit in the Mommy Did You Know store. So I'm super excited about that. So to move on postpartum care and what to expect. I will be using the PowerPoint that I have on the details section of this video. You'll be able to see the PowerPoint, and the PowerPoint is also on the online event page from Eventbrite. So what to expect after you deliver. So as a nurse, the number one thing that I see all the time, and people are freaking out like, oh my goodness, what happened, is shaking. A lot of times, if you think about it, you lose a lot of fluid in your delivery, and there's a lot of changes that's going on in your body. So it's very normal to have shaking after you deliver. So usually you can have some warm blankets, some fluids, and that will help you. Drink some water as well. And then it's just a lot going on with your body. Number 2 is postpartum contractions. Just make sure that your bladder is empty, but you'll actually be contracting more also after you deliver. So it doesn't just end the contractions after. And The contractions, the big thing with that is that they help your uterus to get back to its original position. So before, let's say, although keep in mind, sometimes you won't necessarily have your pre-pregnancy weight, but postpartum contractions are very common after, just as your uterus is getting back to its original position. Another thing is that it prevents hemorrhage, because the uterus needs to stay nice and firm in order to prevent hemorrhage. And then another one is mood swings. But, call your doctor if you feel like it might lean more towards postpartum depression. Does anybody know the difference? And you can just comment in the section, but does anybody know the difference between baby blues and postpartum depression? And you can just comment in the section if you feel like you might know. And I don't bite, so don't worry if you feel like you might not have the best answer. But what would you say is the difference between postpartum depression and baby blues? How would you know if it's something that you would want to look into or not? And you can just comment in this section. Exactly. Postpartum depression lasts a lot longer, and it's a lot more severe. The biggest thing with postpartum depression is that it mostly interferes with your day-to-day life. Baby blues, a lot of people get that. If you think about it, there's so many changes that happens in your body after you have a baby. And then there's a lot of changes in your family dynamics and just everything that's going on. So of course, baby blues is very, very common. However, postpartum depression, and the thing is, I especially want to talk about it today because a lot of people have been having postpartum depression lately as we're going through the whole quarantine and this coronavirus thing and, all of the craziness and stress of coronavirus. So one thing with postpartum depression is that it lasts longer, and you really need a support system for that, for postpartum depression especially. And it lasts longer, it's more intense, and it gets in the way of day-to-day living. And then another thing that you want to think about after you deliver as well that a lot of people don't realize is that actually you'll have period-like bleeding after you deliver. Some people think that they'll just have their period like normal, or some people don't even know that they'll have a little bit of bleeding after they deliver, but it lasts anywhere from a few days to a few weeks. Everybody's different. However, if you might get little small blood clots after you deliver, but if it's the size of your fist or like a golf ball size, that's too much, too big. You definitely want to get that looked into, okay? Another thing is if you are saturating one pad in 1 hour, that is heavy bleeding. In the end of this lesson, we will be doing a test, like a post-test as well, that I want all of you guys to be able to interact with. So that's going to be one of my questions is how do you know if your bleeding is too severe, if it's too heavy? Heavy bleeding is if you fill one pad in 1 hour, okay? So that's very important to know. One pad in 1 hour is heavy bleeding. And then we'll move on in your PowerPoints to postpartum hygiene, which is very important because you want to know how to take care of yourself down there, because in addition to taking care of a baby, you do not want to have a UTI or a yeast infection on top of that. So I know some of you guys will probably be having vaginal deliveries. Some of you guys will probably be having cesarean deliveries. It's just whatever you guys are having, you still need to learn how to have good vaginal hygiene. So number one is you want to change your pads every 2 to 3 hours. You definitely want to change your pads. You don't want to let all of that old dry blood soak there for too long, because that's how you start getting infections and yeast infections, and you definitely don't want that. Next is make sure that you try to pee every 2 to 3 hours. A lot of people don't realize that when their bladder's full, it causes a lot of pain, and it just causes overall increased problems that you don't want to have, such as UTIs. So you want to pee every 2 to 3 hours, change your pads as well every 2 to 3 hours, and use a peri bottle. They'll usually give you like this plastic bottle that has water inside. And fill it up with some warm water. You can even use some soap and you can clean yourself down there. And that, I mean, sometimes it's like so refreshing just to be able to use that peri bottle. And then also just a little tip as well is that when you are peeing, sometimes the acidity of the urine sometimes stings, right after you had a baby. Of course, it's going to be a little tender. But actually, one pro tip is you can actually use that plastic peri bottle the same time that you're peeing, and it will actually neutralize the acidity of the urine and hopefully save you a little bit of pain in that aspect. I hope you guys are taking notes. And then, so we have to change your pads every 2 to 3 hours. Try to urinate as well. Try to use that peri bottle. And peri meds are very good. Dermaplast, Tux pads, you can also get those from CVS, Walmart. They're fantastic. Nothing in the vaginal area for 6 weeks as well. That includes tampons, douching, and intercourse. So make sure nothing in that area for 6 weeks. Another thing is also sitting in tub baths is not really recommended for 6 weeks as well. It's one thing that a lot of people don't realize is they have a baby, and the first thing they want to do is have that beautiful bath with all the candles and everything. You can have a beautiful shower, I guess, but for the first 6 weeks, you do not want to be having too much stagnant water close to that vaginal area, because that's another way that you can have infections as well. And then call the physician if you're having heavy bleeding. And then I have a little bit of a cough, so that's why I have a Halls today, but hopefully I'm getting better soon. So now let's do a little recap with the people that we have so far. So I'm going to ask questions, and you guys can just type. I want to make sure that you guys are listening actively, because it's one thing just to watch a video, and it's another thing to be an active participant in the lessons, and that is my goal. I want to make sure that I'm helping all of you guys. So for the first question, how often should you guys be peeing and changing your pads after you have a baby? So it's kind of an hour range, and you guys can use the PowerPoint. Don't feel like you're cheating, but how often should you guys be changing your pads? Every couple of hours, exactly, like 2 to 3 hours. And Mary Kay is the only person that seems to be answering the questions, but I want to make sure all of you guys are also answering the questions too. So yes, every 2 to 3 hours is perfect. And then for C-sections, cesarean deliveries, I know that a lot of you guys probably will have a cesarean birth. If that happens, it's important that you know what to expect and how to take care of your incision. I would have to say incision care post-delivery is one of the things that people know least about. So after you have your baby, you can still shower after having a cesarean delivery, okay? So that's one thing a lot of people don't realize. They think you have to only have a towel, but no, you can still shower. Just make sure that your incision site is clean and dry after your shower. So you can shower, you can use a normal soap. Just make sure it doesn't have those little beads. You know how sometimes they have those exfoliating beads? I usually recommend not to use those just because those beads can get trapped and potentially cause infections for your new incision site. So you want to make sure that you're showering, keep that incision site clean, dry, pat it with a towel. You don't want to be scrubbing, but you can pat it with a towel. And you can even put, I know that sometimes after you have a baby, you might have a little bit of an overlap from your belly. And some people are nervous about sweat going underneath in that under part of the belly. So what some people do is they'll put like a peri pad right underneath where that incision is. And sometimes that can help as well, just to kind of keep that incision site clean and dry if you feel like you have the overlap with the sweat. Number 3, so we talked about you can still shower, keep your incision site clean and dry. Number 3 is use an abdominal binder, just like a wrap, a support for your belly. So your support can be an abdominal binder, your support can be leggings, whatever it is, but the support really helps because you want to be walking, not only for cesarean deliveries or cesarean birth, but also for vaginal deliveries as well. You want to be walking. The worst thing you can do is lay in the bed and just sit there. And as a nurse, I've seen a lot of things. Sometimes I come in and it's just like straight out of a telenovela where the lady is like sitting there like this, and you have the grandma and the baby's dad like fanning the mom, and she's just like, hi, You don't want to be like that. You want to be able to get out of bed. You can still rest, relax, but at the same time, you want to get out of bed. You don't want to stay in the bed that often because then you can have blood clots and a lot of other complications as well. And then for calling for incisions, the main thing is if you have drainage, if you have a foul odor, excess swelling happens, or if you have all of a sudden intense pain coming from the incision. Keep in mind that with the cesarean delivery, your anesthesia usually lasts about 24 hours or so, the pain relief effect of that. So what happens after that 24 hours is up. Sometimes you'll start having that pain, but keep on with the pain medication. I usually recommend my patients to take the medications around the clock just for the first few days until their pain subsides. And usually most hospitals will give Motrin and Tylenol for cesarean birth. Sometimes they might up it up with a Percocet as needed for breakthrough pain. And then for vaginal deliveries, Motrin really helps with the cramping. And it even helps with engorgement. That's another thing that a lot of people don't realize, that Motrin actually helps with engorgement because it's an anti-inflammatory. So it's one good thing, kind of kill two birds with one stone there. So I have over here slide 24 on your PowerPoint, just in case you're a little confused where we're at, is our next section is keys to recovery. So a lot of people, they want to know, how can they recover faster after childbirth? Of course, you just had a baby. You want to be able to take care of your baby without being stuck in bed and trying to take care of your baby, take care of yourself. You want to be able to recover quicker. So what you want to do, number one, is you want to drink a lot of water. By the way, this is going to be one of the questions on my review test in the end, is the keys to recovery, the 3 keys. So number one is drink a lot of water. Try to stay hydrated. One good way to remember is try to drink a glass of water every time that you feed the baby. So let's say you have to feed the baby every 2 to 3 hours, and you want to drink at least 8 glasses of water. That's every 2 to 3 hours. So what I usually recommend is, all right, it's the 2 to 3 hour mark, go to the restroom, at least you get that pee down, then you come back, get a glass of water, put it on the side of your bed. Then when you're feeding your baby, breastfeeding, bottle feeding, whatever you're doing, you're drinking that glass of water. You're staying hydrated. As I know from personal experience, I got dehydrated with my babies just because I always feed my babies. I take wonderful care of my babies, and then I neglect myself. So you want to be able to drink that water every time you feed the baby. And then try to walk as well, as early and as often as possible. Usually for cesarean deliveries, the minimum time to wait before getting out of bed is about 6 to 8 hours. So you can at least, take one trip to the bathroom after that. For vaginal deliveries, it's usually about 2 hours is the standard that you will probably, if you had an epidural. If you had an epidural, it's normally about 2 hours standard. They'll wait even sometimes a little quicker, like 1 to 2 hours. Then you're able to get out of bed. You can feel your legs, and it's a lot better. It's just all about early and often as possible. Another thing that you want to do is you want to try to urinate as well. Like I said, urinate every 2 to 3 hours, empty that bladder. So we have number 1 is drink a lot of water. Number 2 is walk as early and as often as possible. And number 3 is try to urinate. Okay? So here is my review for you guys. What are the 3 keys to recovery after you have your baby? And I'm going to finish my hose here. And anyone can answer the question. So what are the 3 keys to recovery? If you guys were paying attention, and you can use the PowerPoint, but and whoever wants to answer can answer. So we have 3 keys of recovery here. We were talking about drinking, we were talking about walking, and we were talking about urinating. So exactly, stay hydrated when the baby eats, walk as early and as often as possible, and to empty your bladder. So thank you guys for paying attention. Yes, those are my 3 keys to the recovery. And then I do have some nursing secrets as well. I've been a postpartum nurse now for about 8 years. I sometimes work in labor and delivery as well. And I noticed some things that really help people, help my patients. So I just want to share them with you guys. And these are kind of things that your nurse should help you with, but at the same time, it's good to know that you can do these things or request these things, because I know realistically, not every nurse is like how I am. So everybody, practices nursing differently. But in the end, you have control over your nursing care. You have control over your medical care, and you want to make sure that you're an active participant in your medical care. So number 1 is just one of these nursing secrets is change your clothes ASAP. There's something about being in a hospital gown that just makes you feel like a patient. It just makes you feel like you're in bed. I've noticed that the patients that have the hospital gowns, they actually even have more pain because they're in the bed. They're not really walking. They're not really focused on anything else. So number 1, change your clothes as soon as you can. You don't want to feel like an old man. You're not an old man. You're a strong woman. So you're a strong woman. You can change your clothes, get out of that hospital gown as soon as you can. Normally, I will take my patients out of that gown when they're finished with their fluids. So sometimes you'll have some fluids after you deliver, but when all those fluids are done and like their bleeding's under control, I would usually change them into their clothes. And number 2 is ask when your IV can be removed. I usually take out my IVs about the first day after they deliver, after the delivery of my patient. Just because if, let's say you're breastfeeding or trying to take care of yourself, it's very difficult with an IV in there. And then as long as you don't need it anymore, I normally take it out about 1 day postpartum. So that also means I only take them out if the patient's stable, obviously. So if you don't have any blood pressure issues, no infection issues, no problems with your bleeding, no postpartum hemorrhage, and your vitals have been stable, I'll normally take it out. If, however, let's say you have blood pressure issues, or or let's say your iron levels were low, something like that, then maybe we might have to keep it in a little bit later. But normally, you can be an advocate about this, just because some nurses don't really take it out. But you can request, actually. You have complete control over your medical care, and you can approve or deny as needed for your own body and your own care. And then my 3rd secret, so my first secret was changing out of those clothes. My 2nd secret was trying to take out the IV if possible. And number 3 is try to shower as soon as you can. Now, that doesn't mean that you want to shower right after having a baby, but you can shower when reasonably approved. So let's say you've finished your fluids already, let's say or even your IV's out, your bleeding's okay, you're not feeling dizzy, and you just want to clean up. By all means, take a shower. It's just magical sometimes, just that first shower after having a baby. And then my last part about postpartum care before we start going into newborn care is when to call the doctor. So you should immediately call your doctor for one is infection, so signs of infection. Let's say you have a fever, 100.4 or above. If you start passing large clots, especially those are for infection. Well, large clots is for hemorrhage, but let's say you have a fever, you're passing large clots. If your incision starts to have a lot of drainage or a smell, peeing and urination, which can be UTIs, all of those can be complications after you have a baby. Another one is like chest pain, vomiting, difficulty breathing. Those can actually be signs of blood clots as well. And then, of course, if you have any signs of postpartum depression, such as experiencing thoughts about harming yourself or others, that is a definite red flag that you want to look into right away. So just to recap, for postpartum care, we talked about postpartum hygiene. We talked about making sure that you're peeing often, changing your pads often. We talked a little bit about incisional care, making sure that you're keeping your incision clean and dry, that you call the doctor if you have any incision drainage or swelling. And then we talk about some secrets to help you recover quicker, such as getting out of bed, showering, hopefully taking that IV out, just, different things like that. Anyway, so now, does anybody have any questions about postpartum care before we go into newborn care? And I'm going to try to pop a little pause here again. So we did talk about a lot of stuff. Now, everybody wants to talk about their baby, how to take care of your baby, questions about breastfeeding, questions about bottle feeding. So in the comments, you can say if you are planning on breastfeeding, if you're planning on bottle feeding, if you're doing pumping or mixed feedings. Now, this is something that is very important to know for me, just so that I can focus on you guys individually and figure out what we would like to discuss. So we have breastfeeding. Mary Kay will be breastfeeding. And I do have a lot of information about breastfeeding. I am also a lactation counselor as well as a nurse, and I do consultations as well. And the link to have my consultations is actually in the description for the video, and it's on my website as well, mommydidyouknow.com. I do virtual consultations that are only $25, and that's video as well as telephone, so we can do it together with the family. It doesn't have to be just you. A lot of people like to discuss together, and not only about breastfeeding, but I also, actually the majority of my prenatal consultations are about questions about childbirth. So if you feel like that is you, by all means, please schedule a consultation with me. The link is on the video description, and it's also on my website, mommydidyouknow.com, under the tab consultations. That's on the top in the menu. So you'll be able to see that. So we have our next section is newborn care. So our first section that we want to talk about with newborn care is skin to skin. It's so important. There's so many benefits to it, especially if you want to breastfeed. Skin to skin is one of the best things you want to do. And skin to skin, especially in the first hour of life, is when you want to start, that golden hour where you want to hopefully start your breastfeeding. You want to hopefully start your skin to skin. And that'll definitely help you guys as well. Some benefits of skin to skin. One is breastfeeding is easier. The baby's close, so you can just, mom can notice those feeding cues. The baby starts bobbing their head, and you can go ahead and put the baby onto the breast that way. So it's way easier when the baby's skin to skin with you. Number two is it helps the milk to let down. When baby's skin to skin with you, and your breast starts to have that compression from the hand, and your body starts to feel the baby and the baby's hands and the baby's skin, it naturally releases those milk releasing hormones such as oxytocin, which is the milk letdown hormone. So that's one amazing thing about skin to skin. It's just a natural way if you want to start producing milk more. Number three, less crying and a strong maternal infant bond. Now that's really important because, nobody really wants their baby screaming at all times of the night, but not only for the first few days of life, but you can do skin to skin for as long as you want. Actually, even for a few months. Sometimes, like every now and then, if I was breastfeeding my baby, I would do skin to skin, calm them down. It's something of a very special experience for mom and baby. Number four, it actually helps the baby's blood sugar and the temperature is controlled better. So even sometimes I might have a baby who has a low blood sugar, or let's even say that mom has diabetes. Let's say you have gestational diabetes. And what happens is when you have gestational diabetes, your placenta has been providing the baby with all of this sugar. Then now all of a sudden, the baby does not have those reserves anymore. They don't have that placenta providing them all that sugar. So sometimes the sugar starts to bottom out. I'll usually try to do skin to skin as much as possible with that scenario, just because skin to skin, really, by research and a lot of statistics have shown that skin to skin helps to maintain baby's blood sugar and maintains the baby's temperature. And it actually helps mom as well, which is fantastic. It helps breathing regulation for the baby. Baby's on mommy's skin to skin, the baby starts regulating the breathing. So it's fantastic, especially in those first few hours of life when the baby's transitioning. That skin to skin really helps. lowers mother's blood pressure. That's one thing that a lot of people don't really realize, but skin to skin even helps regulate mom's vital signs and mom's blood pressure. So if you're having some blood pressure issues, as long as you're stable, some skin to skin might actually help, as long as you have somebody with you as well that can help you. Because if you have blood pressure issues, you might have some additional medications that might make you kind of drowsy. And then skin to skin also decreases the risk of postpartum depression. One big way is because of the bonding that's happening between you and the baby. And then another research has actually shown that skin to skin actually lessens the duration of hospital stay. So it helps very much, not only for NICU babies, but for full-term babies as well. But especially for NICU babies too. If you have a NICU baby, try to ask when you can do what they call kangaroo care or skin to skin with your baby, especially in those touch times. Now, our next section is diaper changes, especially for our first-time moms. I know that diaper changes can be a little daunting at times because if you've never done it, you feel like you're going to break your baby by changing the diaper wrong, but that's not going to happen. You work at it. The more you try, the better you'll get. And everybody at one point or another will get a blowout, where their baby just poops all up and down their back. It happens, you just move through it, move on. But there are some tips that I can show you to kind of help you as you're changing diapers to hopefully not make it so messy. My number one is put a new diaper underneath the old diaper. So what I do is when, let's say the diaper's here, I'll actually kind of stuff a new diaper underneath it. And then I'll take that old diaper off. I won't take that old diaper completely off. What I'll do is I'll actually wipe a little bit, front to back for girls especially. I'll wipe a little bit. I'll put all of that dirty stuff in that same little stuff there. And then when it's all clean, then I'll take out the old one and just pop on the new one. Just makes it a lot easier that way. Just because with that way, in case, let's say you're changing the diaper, you take off everything, the baby doesn't have anything underneath, and then all of a sudden starts peeing and pooping everywhere, then you find yourself not only changing diapers, but also the entire crib or the entire changing table or whatever you have. So that's a very quick thing that you can do is put a new diaper underneath. Don't take off anything until you're done cleaning. That way, all you have to do is take off the old one and then quickly just put on the new one. And then for baby girls, always front to back. And then baby boys, always remember to clean underneath the testicles. And then if you have a circumcision site, you want to keep that site clean and dry. You don't necessarily need to be wiping every single time unless there's like poop in there. But what you want to do, if you have a circumcision site, you'll have gauze, you'll have Vaseline, you'll change that dressing every single time you change your baby's diaper. And then if it's visibly soiled, the incision site from the circumcision, definitely you can clean it, you can pat it, and make sure that you have plenty Vaseline in there. Amazon has entire tubs of Vaseline, so that's great. Dollar store has them as well. So those are really great. And then don't be discouraged if the baby pees or poops in the middle of your diaper change either. That happens, it's normal. But don't, be looking at it, because then it's going to cause even more of a mess. But what really helps is putting that new one underneath, and then that will really help you to make sure that your diaper change goes according to plan. I'll just say that way, according to plan. And then make sure all of your changing supplies are next to you, by the way. This is a huge safety hazard or safety risk is if your supplies are not next to you. So let's say you're changing your baby's diaper, and then you leave the baby to grab a diaper, or you leave the baby to get wipes, and then your baby can fall. So it's very important, make sure that all of your diaper changing supplies are next to you. If your baby's in a safe crib, that's something else. But, sometimes if you're one that changes the diaper on the couch or changes the diaper on the bed or wherever you are, wherever you're changing the diaper, make sure that your hands are on the baby, that you don't leave the baby to grab supplies or anything like that. And then, so we talked about diaper changes, we talked about skin to skin. Now we're going to talk about feeding. Now, this is the part that most people want to learn all about. So the first step that you can take when you are learning to feed your baby. You make decisions about feeding your baby. If you want to breastfeed, bottle feed, mixed feed, pumping, whatever your choice might be, is you want to research. Now, you're not going to learn everything there is to know about feeding a baby with just a 1-hour class, unfortunately. I would say I'm a pretty good teacher, but I am not that good of a teacher. You want to make sure that you are researching online. What are the most current practices? What does that mean for you? What are your specific goals for feeding your baby? If it is breastfeeding, how long did you want to feed your baby? If it's bottle feeding, did you want to pump and bottle feed, or did you want to provide formula? All of those things are decisions that you want to base on research. And research does not mean what your friend did and what they are telling you is the best way. Research means looking at peer-reviewed journals, looking at the Academy of Pediatrics. The American Academy of Pediatrics is fantastic. Looking, even CDC sometimes even has different policies and procedures. That is looking at research. Taking classes like this is fantastic from certified people. So when you are reading up, make sure that you're looking at who you are listening to, what are the sources that they are using. Are they just, a mom of, an experienced mom who's giving her advice? That's great, but make sure that's advice. That's not necessarily research. So those are just my little tidbit right there about making sure that you are careful of what you are listening to and what you are basing your decisions off of. Now, there are different methods of feeding, and they generally go into, I would say, like 3 to 4 different categories. Number 1 is exclusively breastfeeding. Exclusively breastfeeding means that the baby has nothing but breast milk. That can mean that the baby's getting the breast milk from the pump. That can mean that the baby's getting the breast milk from direct breastfeeding. But whichever way, the baby is only having breast milk and maybe vitamins or medications. Those are exclusive breastfeeding. Number 2, the second category, is mixed feeding. Mixed feeding is when you have a little bit of breast milk and a little bit of supplementation, whether it be formula. Well, usually it's either breast milk or formula, sometimes even donated, sometimes donor milk as well. Sorry about that. So those mixed feedings is a little bit of the breast milk and a little bit of formula. In that case, when you are mixed feeding, I usually recommend to start with the breast first, just because if you want to direct breastfeed, babies usually, they'll feed a lot more in the beginning of their feeding than they will in the end of the feeding. So then at least the baby starts the feeding at the breast where it's more difficult, because babies don't really like to try that hard. And then you can follow up with the supplementation as necessary. Or sometimes even you might have pumped milk and then supplement milk. If you have that way, some people mix them in the same bottle. I will usually say if you want to make sure that your baby gets mostly breast milk, you can offer the breast milk bottle first and then follow up with the formula bottle as necessary, if you want to make sure that all of the breast milk does not go to waste. And then that's one thing that you can do. So the first category that we had was exclusive. The second category that we had was combo or mixed feeding, where you have a little bit of breast milk and then a little bit of supplementation. And then number 3 is formula only. So those all depend on what you want to do, what your goals are, and your lifestyle as well. For some people, direct breastfeeding doesn't work all the time because let's say they have to go back to work very soon, or whatever have you. So those are all different things to think about. So exclusive breastfeeding at the breast, one thing is it's free. It reduces the risk of SIDS. It's less chance of ear infections, less colic, less gas. And also it even helps with the microflora of the stomach. It kind of lines the intestines, lines the stomach with so many amazing benefits. So that's one benefit of exclusive breastfeeding. One big tip is try to do skin to skin as much as possible. Make sure that you have a good latch as well. And then when you are latching your baby, I'm just going to do a kind of a quick tidbit on latching your baby. But number one is when you are breastfeeding, keep in mind in the beginning, babies, the first like hour or two, they're very active, and that's the best time to breastfeed. Then they kind of hibernate for about 12 to 24 hours after, where they're super, super tired. Then after that hibernation phase, then they go towards kind of like a fiesta time where all they want to do is cluster feed, cluster feed, cluster feed. And that can last for some time. So keep in mind of those different stages. So number one, active stage, first hour of two. That's the best time to breastfeed. Then in that hibernation phase, make sure that your baby's feeding every 2 to 3 hours. You might have to change the baby's clothes, wake the baby up, especially if the baby has passed that 3-hour mark and has not eaten anything. You do not want to have a newborn baby waiting too long without eating. Just because they have not woken up does not mean that they're not hungry. It's just sometimes they're so tired, they just delivered, they used up all of their energy, and they don't have the energy left to say, hey, mom, I'm hungry. But you want to make sure that they're feeding often. So frequent, effective feeding is so important. So for the first 2 hours, they're active, 12 to 24, they're tired. You want to wake them up every 2 to 3 hours to eat. And then after that, they have kind of this cluster feeding time where they feed. But one thing to realize is babies don't only feed because they're hungry, but sometimes they feed for comfort. So that's one thing to realize as a mom as well, is that sometimes the baby's not necessarily breastfeeding constantly just because they want to breastfeed. Sometimes they're breastfeeding as well because they want to feel comforted from you. That's one way that they will feel comforted. And then when you are breastfeeding your baby, there's different steps to take. Number one is you want to make sure that your baby's belly to belly. So like, let's say, I'm just going to move this down over here. So sometimes I see moms hold their baby like this, and then the baby's facing up like this and the belly's up. But actually you want to face the baby towards you. You don't want to be doing one of these numbers. You actually want to face the baby towards you. So the baby's belly will be towards your belly. I would say a firm control over the head. I really like the cross cradle position just because this position gives you a lot of control over the head. So you'll be controlling the head over here. Use the palm of your hand to support the neck, and then you can use your forearm to support the baby. And then you will use your outer arm to put your fingers underneath, kind of like an underwire bra, thumb on the top. You pinch down. Make sure that the baby, what you want to do actually is you can tickle the nose to the nipple, not the mouth to the nipple. So what you can do is express a little bit of the colostrum. When you express your colostrum, it helps activate those senses, those smells. So you express your colostrum, you can put it on the tip of the nipple a little bit. You can even have the baby smell it. And then you put your nose to the nipple. And then when the baby smells that colostrum, they open up nice and wide. They go, ah, and then they'll latch on. And it's a much deeper latch than what you would get if the baby was going just mouth to nipple. So that's one small thing you can do that makes such a big difference. So you'll do tummy to tummy, nose to nipple, okay, nose to nipple, open, up, and then wide open latch, okay? So those are just some steps that you can take for that. And when I'm just finishing my other hauls, hopefully this cough goes away soon. Now, does anybody have any questions about breastfeeding or anything specific that I can be able to answer? Because I'm sure that you guys have a lot of questions. So for those that are breastfeeding, do you have any questions? At least we did talk about how often to breastfeed, the technique and position, belly to belly, nose to nipple. Make sure the baby's aligned as well. Make sure that the baby's in a comfortable position. If you guys did have any questions, please, you can comment below, ask me. I would be more than happy to answer your questions. You know, that's what I'm here for. And, you know, everybody has different perspectives or different goals and different things that they want out of their breastfeeding experience or out of their pumping experience. So my next section is about pumping. So For starters, pumping after you deliver is mostly for stimulation, not really for production. Because it takes a little bit of time for your milk to come in. It normally takes about 2 to 3 days for your milk to come in. 2 to 3 is like the magic number. I mean, 2 to 3 is like when everything happens, but it normally takes some time for your milk to come in, but your milk will come in quicker when you are having frequent and effective breastfeeding, okay? In the beginning, what you have is colostrum, okay? Colostrum is thick, it's beautiful, it's just what the baby needs. It's liquid gold, okay? It takes about 2 to 3 hours for your mature, 2 to 3 hours, 2 to 3 days for your mature milk to come in, depending on how frequently you're feeding your baby. The more the baby is emptying the breast, the faster you're gonna get those hormones in to tell your body to start creating more milk, okay? So those are different things to think about. Now, I actually have had some patients that I'm admitting them postpartum, let's say a few hours after they deliver, and they go, oh, the baby is not latching on, can I have a pump? So a pump really is for separation in the beginning, or if the baby's not latching on more than 24 hours. So let's say 24 hours have passed by, the baby still has not really gotten the hang of the breastfeeding thing, still not really latching on correctly, then I would say, okay, why don't we have a pump to make up for some lost stimulation? Maybe we can hand express a little bit and give it to the baby that way. You know, that's one way that you will be able to provide some milk to the baby. Number two is, let's say mom's unstable or baby's unstable. You know, you would like to say that everything's perfect, but let's say things do not go all perfect. And for whatever reason, baby has to be observed in the NICU, or mom's blood pressure goes up, or mom has a hemorrhage or something happens like that, and there's a separation. At that point, you would want to start pumping within preferably the first 1 to 6 hours after you have your baby. That's just one way to start those milk production, to start your milk hormones, because your body needs that message. It needs that message to click. Hey, I think the baby's here. Now, don't be discouraged if nothing comes out, because in the beginning, it's it's too thick, that colostrum. It's very thick, and it's very possible that not much is going to come out. But that's okay. You'll just move on from that, continue stimulation every 2 to 3 hours. And then there's also formula as a choice. So if formula is your choice, make sure that the baby can tolerate the formula. Be open with your pediatrician as necessary. If the formula is not working for your baby, if the baby has fussiness, gas, different things like that, those are all things, especially vomiting. Some spitting after the baby is born is normal, but if the baby is vomiting a lot, especially vomiting an entire feeding, you definitely want to make sure that the formula is better. So you might have to change into kind of a more gentler formula if necessary. And then when you're bottle feeding, make sure that the chin is elevated and it's supported. You try to offer, if you're doing breast and bottle or breast and formula, try to offer the breast first, and then you can follow up with the formula as necessary. And then my last slide for the babies is when to call the pediatrician. So call the doctor if the baby has any fever, like 100.5 or above, if there's vomiting, especially 2 or more feedings in a row, and especially if it's accompanied with diarrhea. Those are all different reasons to call the pediatrician. And then if you see any difficulty breathing, signs of respiratory distress can be nasal flaring. That's when all of a sudden their nose kind of starts like going up a little bit. It's nasal flaring. Or retractions. When the baby's using a lot of accessory muscles to breathe, those are retractions. And then fast breathing as well. Babies naturally breathe around 30 to 60 times per minute. If it's over that, and then that might be a sign that something might not be quite right. Keep in mind that babies do not have regular breathing. So like for an adult, you look at their wave for their breathing, and it pretty much, it looks like this. It's pretty regular and constant. Babies, they'll breathe kind of irregular. They go boom, 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 and they'll stop for a little bit, and then they go boom, boom, boom again. That's normal. But within that 1 minute time frame, how many times is that baby breathing? If it's above 60 or less than 30, that might be a call for your pediatrician as well. And then especially if it's accompanied by the other signs of respiratory distress, such as nasal flaring and retractions, or even changing colors. So those are all different signs. And then number 4 is difficulty waking up for feedings, especially if it's accompanied by yellowing of the skin, jaundice. Sometimes babies that are jaundiced, they can get very lethargic or tired. So that can be one reason, or another reason for difficulty waking up and being lethargic is actually infection. So those are different things to think about. Then fewer than 3 wet diapers a day. Normally, for the first week of life, you'll have 1 wet diaper on the first day, 2 wet diapers on the second, 3 on the third, 4 on the fourth, so on and so forth, up until the 6th day. After that, it'll be around 6 on average. Some babies can have much more than that, but as long as they have that minimum, that is what we're looking for. So let's say it's the 4th day, you want to have at least 4 wet diapers. And then the poop diapers, you'll want about 2 to 3 as well. And then especially if there's odor or drainage from the umbilical stump, that's another reason that you would want to call the pediatrician. So for the umbilical stump, it normally falls off about 2 to 3 weeks. Man, 2 to 3 really is pretty common, huh? But it takes sometimes quicker. Sometimes it can be even a week or 2. For one of my babies, it fell off within the first week. And then another one of mine was actually on for like 2.5 weeks, and it had to be cauterized off because it even started to get infected. So you definitely want to keep an eye on that. And actually, if you have the odor, drainage from the umbilical stump, and you'll actually notice that as well. But other than that, just keep it clean and dry. They used to say to use alcohol swabs, but they're actually saying now that alcohol swabs does absolutely nothing. You can just use a washcloth and then dry it afterwards, and then just make sure it's dry. So let's do a little review. So we have a few people on now. Now, I'm going to be doing a giveaway, and I will be giving away a $25 credit for our store, and that store you can buy maternity clothes, breastfeeding clothes, baby clothes. I even have like normal clothes there, whatever you like. However, the only way you would be entered for the giveaway is if you are active in this review. All right, so we have a few people here. So my number 1 is what are the 3 keys to recovery? So you can use the PowerPoint as you want. So our first question is, what are some keys to recovery? What are different things that you want to do after you have your baby to try to recover quicker or recover faster? And anybody can answer that question. And I will give you some time to think about that, because I know that we went over a lot of stuff today. I really hope that this has been helpful for you guys. Drinking water, urinating often, and walking. Exactly. So those are some keys to recovery to help to make sure that you recover quicker after you have your baby. And then our next few questions are going to be about newborn care. So what are some benefits of skin-to-skin time? So we talked about a lot of different benefits, but if you can just name a few benefits of skin-to-skin. And skin-to-skin should be in the first hour of life minimally, and then you can do skin-to-skin as long as you want after that. So some people even do skin-to-skin later on, even after, but you don't even really need to dress your baby for the first few days. You can just have the baby skin-to-skin with you, skin-to-skin with dad as well, or whoever your support person is can also do skin-to-skin. Exactly, less likely for postpartum depression. Breastfeeding is easier. You see those feeding cues. It helps baby's blood sugar. It helps the baby maintain the temperature. It helps all of those wonderful, wonderful things. And then let's see. What are some ways that you can latch the baby? So we talked about a few steps to latch the baby on. What are a few of those steps that we talked about? So we talked about the position. We talked about some tips to help the baby open wider and get the baby active. So what are some things that you can do to help the baby latch on better? And there's so many different things that you can do, but We just talked about a few. Yes, nose to nipple, try to breastfeed as soon as possible, skin to skin, exactly. Belly to belly, that is one that I see a lot of moms kind of forget about. I would say 9 times out of 10 when I come into a room and the mom's like, oh yeah, the breastfeeding is so painful and I don't know why, and they have blisters and they have sores, I'll have them show me how they're breastfeeding, and most of the time their baby's belly is up instead of belly to belly. And that's something that makes a huge difference in the latch and the positioning. And then let's see, what are some reasons, and then this is the last question, what are some reasons that you would call the pediatrician? So we talked about a few: signs of infection, signs of jaundice, respiratory distress. What are different signs of all of those? Exactly. So you would call your doctor if your baby's dehydrated, and one sign of that is less than 3 wet diapers or less than the required diapers for that day. If the baby's not pooping well, if there's discharge, especially if there's discharge or foul odor coming from the umbilical cord, different things like that. Then if the baby's yellow, not breathing very well, all of those are different signs of respiratory distress, for the breathing well, retractions, nasal flaring, exactly. So Mary Kay, you probably know that you won my giveaway. Yay! So did you register for my class, and is that the name that's, sorry, is Mary Kay the name that you registered for the class under? Because then I have your email address. If not, you can always email me as well. My email address is mommydidyounknow@gmail.com. So I'll try to find you on the list. Okay, well, either way, I can look for either one of those names, and then I'll be able to email you the coupon code with the link of how to redeem it and everything. I just wanted to say that it was a pleasure, everybody, for meeting you guys today and working with you. I know that we had a lot of people that were watching but preferred to be more viewers, and that's great. If you like watching videos, I do have a whole bunch of videos, and you can always subscribe so that you don't miss out any of the videos that I post. And if you do have any recommendations or questions, concerns before you deliver or even after, you can always contact me, mommydidyounknow@gmail.com. I can schedule you with consultations or even just answer some simple questions. Also on my website, I do have free prenatal classes. I have breastfeeding classes on there. I have a lot of resources, blogs. So, and I really do genuinely, I love teaching. So if you guys have anything, any concerns that you would like to say, you can always share with me. All right. But I just wanted to say that it was a pleasure to meet you all. And you can always sign up for future classes from the Eventbrite page that's also on the description. And it is such a pleasure. You guys are all very welcome. And I wish you all the good rest of the day. And I really hope that this video helped, that this class helped, that it helped answer some questions, and hopefully you feel a little bit more confident about taking your baby home. So you can always follow me around as well. So, and like I said, contact me anytime, okay? So I wish you guys all the best. Have a wonderful day, and it was a pleasure to meet you all.